Composite fillings. So we are doing a series of videos on the type of dental fillings, where they are used for, and what is the approximate cost of those fillings. In this video we'll look at what are composites, where do we use those fillings, and how much they are going to cost. Typically the term composite means that there are two or more materials combined to form a material. When it comes to dental fillings or dental restorative materials, these are typically a resin and a filler. The resin is what forms the basic the filling material. The filler is giving it strength and to modify the property of the resin to suit to the best needs of our tooth, for us to function well, for us to eat and chew well on those fillings, and also to protect the remaining tooth structure. So that's what a composite basically does. There are many different types of composites. They are called generations of composite. You have got the hybrid composites, micro hybrid composite, nano composites, nano filled. So there are various types of composites, but in general what we need to understand is these are restorative materials. These restorative materials are for filling a decayed portion of a tooth. Here we will have a tooth that has been decayed. The decay is progressed from the enamel to the dentine, or just enamel only. So when we are having a decay that is in progress in the tooth structure but not involving the pulp or the innermost layer of the tooth, we typically remove the decayed portion of the tooth structure and then replace with a tooth colored material or a tooth like material. So basically these composites, they behave like enamel or behave like dentine, behave like tooth. So the properties of the material is such that they mimic the lost tooth structure. They also look like the tooth color, and also the structure and the nature of the composite is such that they bond to the tooth structure. The advantage of they bond to the tooth structure is because wherever there is decay, we will be able to minimally remove those decay, and only in those areas where there is loss of tooth structure we can actually put a composite, because it can actually bond to the tooth structure. If it's not bonded, say if it has to be mechanically locked into place, then we need to remove lot more tooth structure for the filling to be placed. So we will look into it, how this actually filling is going to be done, what are the different stages in filling will happen. Of course, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja and Amalapuram. If you have not yet subscribed to our channel Pearls Dentistry, please do subscribe to our channel. We've got a whole bunch of videos coming out in the next 1 year. Of course, always do like our videos, share, and if you have any questions, always feel free to comment and ask us a question. We'll be more than happy to answer your questions. So now let's look into how the process actually happens, what we actually do when you do the composites. Now if you look at this tooth, you can see that there is a black mark that is there, that resembles the decay, or that's what represents the decay. Of course, this is not the natural tooth, there is a model tooth. I'm explaining the process through a model, what is actually done. So in our previous video we have looked at a sealant where we need not remove any tooth structure. Here it is very important we remove all the decayed tooth structure. We cannot leave any decayed tooth structure in the tooth. So we will use what is called an arrow true handpiece, which is a high speed drill with a burr. So when we run the burr, you can see it removes tooth structure. So it runs at a high speed. You can see that all the black mark is gone, and you can see a cavity has been prepared to receive a filling. So wherever there is decay, we have removed the tooth structure. Now once the tooth structure is removed, we of course clean the tooth. In the natural tooth scenario, we will ensure that there is no saliva contamination. We protect the tooth, we apply a dam to protect the tooth to ensure that there is no saliva contamination there. We clean it. The next step after cleaning is applying what is called an etchant. The etchant is typically a blue color, a phosphoric acid liquid. We apply the etchant going from the outside to the inside. Once you have applied the etchant what basically does is it creates micropores into the tooth structure. It helps to retain the tooth structure in the filling onto the tooth structure. That's what we do it. Then we wash it. We wash the HN completely. You can see me that HN is completely washed. The blue color is not there anymore. Once the HN is completely washed, again we gently remove the excess moisture. Once we remove the excess moisture, we protect the tooth from saliva. As I said, we will use a dam, we will use cotton rolls, saliva ejectors will be there which will protect the tooth completely. Once we protect the tooth, we will apply what is called a bonding agent. The bonding agent is something which usually comes in a bottle like this, and we take the bonding agent in a bristle brush, take the bonding agent like this, and then we will nicely wet the tooth structure, move the bonding agent into it, ensure that the tooth structure is completely wetted by the bonding agent. Once it is done, we wait for the bonding agent to go and percolate into all the micropores that the etchant has created. Wait it, just remove the excess moisture again. Then what we do is something called the light cure, which we cure the bonding agent there. Now you can see the light is actually helping the bonding agent create those tags into the tooth structure as well as to the future resin or the restoration which you are going to put. We complete the curing. Once it's complete, now the tooth is ready to be filled. Now what we have done, we have cleaned the tooth, removed all decay, cleaned the tooth again, etch and then bond. Next is we do a restorative filling. The restorative fillings are typically can happen, it can happen, it comes in a tube, it can come in a flowable form also, depending on what material we use. We typically take a little amount of the material. You can see me actually taking a little amount of the material and using that material, I'm just going to place it and then we are going to pack the material. So of course this is only for demo. When we pack the material, we add it in layers. We add the enamel dentine portion first, then the enamel portion first. We build wall by wall. So once we add it, we can actually cure it. So once we cure it, the material sets. You can see the material is no more soft. It's become hard. So once it's hard, and then what we do is we clean it again, we polish it, we check how the bite is to see how the bite is joining, and then the process is completed. So now, we did a demo of this is what is called a class 1. Sometimes the wall of the tooth structure will not be there, it's called a class 2 cavity. Sometimes the front tooth will get involved, only the side is involved, is called a class 3. The edge is also involved, it's called a class 4. So when you have the different scenario, we can use either a plastic matrix strip we will use to ensure that the filling doesn't come on to the adjacent tooth, or sometimes we'll use a metal matrix strip for the back teeth and then hold so that the filling material doesn't flow on to the next tooth. So these are some of the methods by which we use the restorative material for different purposes. Of course, there's another kind of restoration called a class 5 on the sides, which we will look into it in a different video. Typically these fillings are very long term in nature, very definitive. These are permanent restorations, ensuring that we can function well with our teeth and eat normally, function normally. The cost of this filling again will depend on, I said no, there are class 1, class 2, class 3, class 4. So at each of these instances we'll use different kind of material, we use a different technique to bond. So the type of filling material used, the type of bonding agents we use, how advanced they are, so will vary the cost per filling. So anywhere typically the cost per filling can be starting at anywhere from 1,000 to 1,500 rupees to up to 3,000 or 3,500 rupees more, where we do some extensive restorations are done to then restore a lot of tooth structure. So this will be the typical range of cost for various kinds of filling types and also using filling material with these composites. Hope you like this video. If there are any questions, please do ask us. We'll be happy to answer in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja, Namalapuram since the year 2001. And please do subscribe to our channel. Thank you and bye-bye.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.